Our first guest is an internationally known internist and addiction specialist and host of the Dr. Drew podcast. Dr. Drew has been battling COVID-19 since the end of 2020 and has been documenting his journey on Instagram. Let's take a look.
I've been sick for the last 4 days.
Drew got really bad fever for 24 hours, then just felt really rotten.
No, the fever kept going till last night.
Yeah, and then it comes back and forth, right?
Yeah.
COVID or no, not, we will know tomorrow morning.
Yep.
The first 3 days when you're in the flu part of it, temperature was 102 or so, a lot of back pain. And I think I have some lung damage left over from that.
Every day now has become like Groundhog Day. Every day is exactly the same, and I feel like
Day 9, and I still feel terrible.
the COVID fog. It is profound. I can't concentrate. I can't find words. And sitting in the bed most of the day, scrolling through TikToks for 2 hours. Don't even know what's happened after the course of that. It's what I imagine a severe head injury would be like. It feels like I've been hit over the head, and
It's hard for me to concentrate. So what was I saying? That, Jesus.
Day 12, I got to tell you, it's very overwhelming. So, still kind of short of breath.
Get my brain, I got to kick it into gear. It's very hard. I have to concentrate very hard to get things to work, particularly as I get tired and fatigued talking about things. Lost my train of thought.
Now I have acute diverticulitis on top of COVID, which is a deep-seated infection, sort of a localized peritonitis around the colon. The fatigue of the COVID with the fatigue of the diverticulitis is it's extraordinary. It's quite it's difficult to tolerate all this.
Trust me, you don't want this. You don't want it. 17 days in, I barely left this room. This thing is a beast. It is a beast.
And joining us now via Zoom is Dr. Drew himself. Dr. Drew, welcome back to the show. It's always a pleasure to have you.
Thank you. It's great to see you. I'm looking a bit better than the ragged condition I was in during those Instagram lives, boy.
Well, I had no clue what you were dealing with, and we're all so sorry to hear that you...
You know what? I'm gonna stop you. Better me than many other people for a couple reasons. One, I'm just at the cusp where I'm going to have a bad time, but not so old that I'm going to have a really bad time. And I thought to myself, I'm so grateful because now I can see this from the patient perspective and the physician perspective, and hopefully I can help people as a result.
Why did you decide to share your saga?
As I was lying there in quite a bit of misery, this thing's a beast, I thought, wow, I'm learning about this thing from the inside out, and there's some things that I know now that other people need to know. Like all this focus on fatality associated with this illness is missing a big point about the morbidity of it, the injury, the way, the misery associated with it. And now I'm technically a long hauler. I'm having a lot of persistent symptoms, and that's a relatively common thing.